beautiful. I mean, for some reminders and some. So that's basically that. We also have the.
For us at MCRI, it's been a real privilege and a great honour to work.
Before, but it's also a special welcome to our.
Thank you for the invitation. And I must begin by saying that I'm very excited that we have a research and innovative unit within the Ministry of Health now. And that unit is led capably by Dr. Eric Rafai and his group. And that's something that, if anything, that I'm very proud of in the 1 year that I've been in office, is the fact that we have a research unit that is now functioning. I shake hands with all the Ministry of Health Denham staff 8 o'clock on a Monday morning. And I can tell you that they are one of the first people in the office. And it's really funny because I came from an academic background, and we know researchers often come late into the office. But this is the only research office in the whole of the world that I've known that come before 8 to the office. So they're very dedicated. Maybe that's something that the Australians can learn from. But I thank also the Murdoch Children's Research Institute for their role in partnering with us. And they've been doing it for quite a long time. It's been a lot of good work that we, with the Ministry of Health and the Murdoch Institute, and also together at some instances with FNU, have been able to do some great work together. And recently, we've had some very interesting discussions about rolling out the Conjugate Typhoid vaccine, which has a 10 years protection. And we are very hopeful that that will be out very soon in Fiji and a particular region that we'll begin it with. But this is the level in which we have been working with the Murdoch Institute, and I'm very proud to say that I'm very delighted at some of the work that we've been doing together. They have also been part and parcel of us with the Big Shift project, and as we're all aware, with the Shift project, it started first in some of the islands, predominantly of the Waqainabete group, if I can remember, it was Motoriki, now maybe Koro, where they conducted it and actually looked at what interventions for scabies will be very useful. And by the end of it, they finally realized that the use of the ivermectin oral dose was actually very significant. And we went ahead and had the Big Shift project, which was rolled out in Bunolebu. In the first dosage, there was 97% of the target population. And in the second dose was 87% of the target population. I was also, during the measles campaign, I actually went into Bunolebu. Because as you remember, with the measles campaign, we started with Seronamosi, then we went central, then we went west and northern and eastern. So I went into Bunolebu and I spent the week in Bunolebu, basically just chasing our nurses down and our doctors and making sure we were going into those areas. It was really interesting. I went to places, for example, in the middle of Waturowa, a village called Bale Yani just off Nayarambale. And they said, oh, this is the second time this year that medical team have come to do an intervention. You guys are immunizing us with measles, but you also had the Big Shift project that came through. And for that, I'm really grateful to the extent by which we're very pedantic with the interventions that we put in place. Because unless we actually wear the boots and get onto the ground and actually do these things, then we actually will have outcomes. And the outcome of that, that we will see as the research comes in. But with the measles, we know that in this country, there was only 28 people that had measles. We contained it very well, and no one died. And that is because we all worked very hard in that space. And I must say that yesterday I was in Navua Hospital just thanking the staff again, because ground zero was Navua. Seronamosi was ground zero for measles. And all the hard work they put in really protected this nation. They contained it within Wanendoi. It went to Nobunikambi up in Namosi. They went there. They asked me, you have to go to Nobunikambi. So I went to Nobunikambi in Namosi. Then they said, it's now in Nasilai. So we went to Nasilai. It's in Monira. We went to Monira. Then they said, it's in Somaki. I said, that's very close to my wife's village. They said, you have to go. So I went, crossed the river, got hit by big bowls of grog, but that's all right. We managed to contain it. And I think one of the things that I enjoy about the way that we are moving now is that we are moving very strong in research, but also we are moving very strong in intervention. And the two have to go hand in hand if we are really going to turn this country around, and we are beginning to do it. The global significance of the Big Shift project is what Fiji is going to show the world, and Fiji will continue to show the world with this, with support that the Murdoch Institute have been giving us. Health research is a key tool to deliver change that positively impacts the lives and health outcomes of our people. As I said, it's not only about being able to see what needs to be done, it's actually being able to see that we also have interventional research that actually makes an outcome. And Professor Rajat is agreeing to it because he's done a lot of work with the VCSA Sai Health Center and the role that they've done in Vunda. And, it pays dividends over the years, all that hard work that they've been doing. Program implementation, identifying the priorities, support evidence. It assists in strengthening health systems and ensures we're utilizing our healthcare resources in a cost-effective and efficient manner. For several decades, Pacific Island countries have given high priority to the implementation of health programs. We in Fiji encourage both implementation and research, and I've discussed my excitement around the research and innovation unit that we have within the ministry, even though we are supported actively by other supporters such as FNU, the Murdoch Institute, the University of Fiji, and USP, the same. But as a government institution, we need to take the lead, and that's my excitement this morning. The strengthening of ethics committees and partnering with donor agencies to support the undergraduate and postgraduate students doing research. And I'm grateful to see that we are taking strides as partners in setting research standards that will ultimately strengthen public health research in Fiji and the Pacific. It's not about surgery anymore. It's not about medicine anymore. It's not about anesthesia anymore. It's about public health. And public health encompasses the whole scheme of things. Interestingly, I said to Dr. Susana one day, Dr. Susana, the Divisional Medical Officer, Western, we were sitting down in the beginning of the year, the 2nd of January, we were sitting down in office and going through, because I wanted the medical officers now to be attached to a zone nurse. So you know how you have a medical area, and you have, in that medical area, you might have 3 zones and the nurses. Well, now we have some health centers that have 5, 6, 7 doctors. So I said, Dr. Susana, I want also a doctor to be attached with the nurse in a zone area. So they go with the nurse one afternoon a week, they take a backpack, they see the domiciliary cases, and she was so excited. And I said, in my excitement, I let this loose. So I'll tell you anyway, because I know she's told all her stuff. I said, Dr. Susana, if I were to live my life alone, again, I want to be a DMO. Fiji is evolving quickly, and so must be the pace of our pursuit to gather evidence that will allow us to remain relevant and consistent. And the question that has to be answered is the prevalence of NCD here is as a result of the changes we see, not only with the environment, not only with the lifestyle, but also with climate change. How about the challenges around dengue, lepto, typhoid? Is it related to climate change? Skin infections, childhood obesity, mental health, suicide, and even bullying in our children and adolescents. Could they be also, in a way, related to climate change? It seems like a far-off connection, but these are the type of questions that we need to ask. I am very grateful that we did a lot of hard work in the communities last year. We, together working with the health inspectors, the sub-divisional medical officers, we really went out big time. We did cleanup campaigns. We just worked on water, sanitation. Salote was our senior subdivision health inspector up in Televu. She alone, working with the community, put in 300 water seal toilets. That was her job. She's now in Navua. I met her up in a village called Sambata in the district of Nuku in Serua. So you drive up for about 1.5 hours, then you get on a boat and you go down. And then I met Salote there in a district meeting. And I said, oh, thank you. You will have also water seal toilets because Salote is here. So, we really worked hard. And I think that's actually paying dividends in the fact that we've got lower numbers of typhoid in the beginning of this year. In terms of dengue, we've only had about 20 cases, and all of them, predominantly, they've been around the Lambasa, greater Lambasa area. Leptospirosis, we've seen only about 3 or 4 leptospirosis, and again, predominantly in that area. Typhoid, going back to typhoid, we've had about 6 typhoid in the central division, and about 4 of them in particular in one village. And sadly, that's a village that I visited last year, and we said we're going to work with them around wash. So it tells me that we haven't actually done some work on it. We need to go back and do it. But I think the great strides around the public health interventions around WASH, the visiting the communities, the cleanup campaigns has paid dividends. And research can be very useful to see if these interventions actually answer that question. The Wolbachia program, for example, has also showing some promising results with the reductions in dengue. And as you know, this World Mosquito Program, or Wolbachia, was rolled out initially in the Central Division, and then we rolled it out in the Western Division, and we're currently in the monitoring phase. And the question I posed was, are we getting dengue within the north in Lambasa? Is one of the reasons is because we haven't rolled out the Wolbachia campaign. The biggest driver of outbreaks now is, one of them is climate change, and that is now becoming a household topic in our region. I remember being part of the response to severe tropical cyclone Winston that cut a path of destruction in our islands with wind force at one stage of up to 280 kilometers an hour. It was recorded as a very severe tropical cyclone. But the question is it also having an effect in terms of the communicable diseases that we are seeing? Global studies suggest that the effects of climate change is expected to affect a wide range of environmental and social determinants of health, including heat waves, rising sea levels, and other extreme weather events, contributing to a series of challenges ranging from food security to a scarcity of drinking water and increases in communicable, respiratory, and non-communicable diseases. As part of a global repercussion to human health in the wake of climate change, the WHO recorded that in 2004, climate change was responsible for 140,000 deaths. Conservative estimates suggest that climate change will cause 250,000 additional deaths per year by the middle of the century. The poorest and the most vulnerable population in low-income countries, particularly children and the elderly, are among those most at risk. And that is why, as a Minister of Health, we continue to embrace the vision of the Honourable Prime Minister in leaving no one behind. We've embarked on the universal health coverage with the pillars that we have stated of leaving no one behind, reaching the unreached, and decreasing the out-of-pocket expenses. And I'll give you an example. As we speak, the marine vessel Waqainabete, which is an $18.5 million hospital ship, is in their SAWAs, during their SAWAs, with clinicians, with public health specialists, with our colleagues from Fiji Pharmaceutical and Biomedical Services, and also with our plumbers and carpenters fixing things on the go. We also did something similar around the islands of the northern maritime area just before Parliament Week. So we went to Yandua, to Kia, to Vikombia, to Yavata, to Ngamea, to Yanuva, to Tabiuni, to Rambi and Kioa within 7 days. And we did something similar. It's interesting, when you actually go into these places, then you actually see that they are marginalized in these areas. They are marginalized, Fijians. I'll tell you a small story. We went to one of the small islands in the northern maritime areas, and there was a lady who had had a stroke, was up in Lambasa Hospital, came back about 1.5 years ago, and was being looked after by her husband. And the lady was lying at home. So we delayed our coming back for about a few hours so that the physiotherapist can work with her. When we left, she walked with support to the door to say goodbye to us. And that in itself tells me the importance of our reaching the unreached. We can't leave the marginalized to be marginalized. We have to put the boots on and walk the talk and go to these places and actually begin to do what needs to be done. This is our moment to ask questions. This is our moment to inquire. Is the way we're doing things the way that should be done, or is it time for change? And that's what research does. That's what research helps us with. That's what research validates the answers to these questions. And that defines for us the future that together we, and together with our children, will be able to take and direct ourselves to. I'm told that this symposium will also serve as a platform to acknowledging our local researchers for conducting and upholding high quality and high standards of research in Fiji, translating high quality research evidence into evidence-based medicine, and enactions of healthcare policy and healthcare programs. To you all, I say congratulations and thank you. Enjoy the day. Make sure that you make full use of the caliber of the professionals that stand before you as facilitators in the coming hour. And let me say once more that I'm very honored to be with you this morning. I'm really sorry that I'm a few minutes late, but blame the physicians. Thank you.
I have to say, your passion for, and long may it continue.
Okay. 1, 3, 1, 2.